A group of MPs say that the government should decriminalise possession of all illegal drugs. The Health and Social Care Committee say that such a move could help prevent the rising number of drug-related deaths. 2018 saw a 16% rise in the number of drug-related deaths when compared to 2017. Well, let's talk now to Edward Davies, who's the Director of Policy at the Centre for Social Justice, which is a conservative think tank focused on helping people in poverty. Edward, thank you very much for coming along. So this is what the Health and Social Care Committee is saying in terms of suggesting at least that the government examines decriminalising drug use for personal use from a criminal offence to a civil matter. But you don't think that decriminalisation should be part of the debate, do you? Why not?
Yeah, so I mean the report's hugely welcome. For us to just be sitting here talking about this issue is quite unusual, and so it is a good thing. But it proposes a whole raft of changes. Some of them are excellent, and some of them, like decriminalisation, I have more concerns about. When you look at around the world at the liberalisation of drug laws, it's not always gone well. The decriminalisation argument comes principally from what's gone on in Portugal, and the really important thing to know about Portugal is it's not just about decriminalisation. It is about huge investment in deterring people away from drugs, from actually investing properly in recovery and treatment services. And that in the UK in particular is an area where actually we have a slightly shameful record over the last 10 years.
So you agree with this report that there should be more investment in those support, education, treatment services. However, budget cuts, I think, of nearly 30% in the last 3 years to those in the UK. Am I right in saying?
That's exactly right, yeah. So over the last sort of 6 or 7 years, we've devolved funding to local authorities who are very squeezed. It's not their fault necessarily, but they have pulled back on it. Actually, we spoke to a councillor recently who said, simply holding his hands up, no one ever says my council must provide more drug and alcohol treatment services. They talk about other things. And so we are able to cut them. We've cut them by 30%. There are treatment centres closing every month now around the country.
So are you opposed to decriminalisation from an ideological perspective, if you like, or are you saying you can't have decriminalisation if you don't have the money going into these services to try to, help people to stop them getting addicted in the first place?
Yeah, I think we need to disentangle what's going on. I think the danger is we look at Portugal and say the success is due to decriminalisation. It's not. It's due to treatment, it's due to recovery, and it's due to deterrent. And we know that because if we look elsewhere around the world, liberalising drug laws has had really negative consequences. We've seen sort of black markets opening up in Canada. We've seen a huge increase in use, and actually our own research at the Centre for Social Justice showed that we should expect, if we sort of liberalise drug laws, millions of new users.
You're talking about Portugal because that is an example that the Health and Social Care Committee talk about in their report. But just to come back to that, the point I was asking about a moment ago, what you're saying is that decriminalisation on its own doesn't work, in your opinion. You think it's got to be accompanied by the extra funding for those support services, treatment services. So if that money was in place, would you then think that decriminalisation might be something that could help? No,
I think it's a very high-risk strategy, knowing that liberalisation can cause these problems if we liberalise our drug laws. And actually the benefit we want to achieve can be done without decriminalising drugs. So there's some great examples already around the country. In Thames Valley, for example, where a bit like a sort of speed awareness course, if you're found with drugs, you're sent to a recovery centre. And you're shown actually the consequences of your drug use. And actually as well, you pay for those recovery centres that are in trouble at the moment. So there's ways we can do this without the need to decriminalise it and open that can of worms.
So you're saying that decriminalisation in and of itself is still acting as a deterrent to some people?
Very much so. So our polling at the CSJ, we did representative polling of the country, and we found that there would be definitely millions of people would try drugs who hadn't before, and for every 10 people that try it, you should expect one to develop a serious problem. So we would be creating hundreds of thousands of people with very serious drug problems overnight.
Is there any prospect of getting the additional funding that you think is needed for drug treatment services, given that we know budgets are so stretched, and you say that you haven't heard a local provider ever saying, well, we need to spend more money on this area?
Yeah, I think it's really important to see addiction in the round here, because we sometimes focus on the drug issue. Actually, we've got about 430,000 problem gamblers. We've got more than that with a drink problem. We've got huge amounts of money in those industries, but we've got huge amounts of money as a country that we could focus on treatment for people with addictions, and at the moment we're choosing not to. We can make that choice. We could do that by funding it from gambling levies, we could do it from drinks, but we don't have to do that. We could take it from general taxation too. But it is a massive growing issue, and we are not doing treatment and recovery well.
Okay, Edward Davies, Director of Policy at the Centre for Social Research. Thank you. Centre for Social Justice, I beg your pardon. Thank you very much.